My name is Dr. Lorraine Ndjoze. I'm a specialist pediatrician employed by the Ministry of Health and Social Services, working at Windhoek Central Hospital in the neonatal ICU and pediatric intensive care unit also. I got the opportunity to do the pediatric emergency care with University of Edinburgh, which I completed in 2023. Windhoek Central is mainly a public hospital, and I'm not doing anything in private yet at the moment. The course was a fast-paced online course that was spread over 2 years with excellent faculty members that were always checking up on you. And we had weekly submission, and that allowed you to read broadly because you couldn't make the submission without reading the latest evidence-based medicine in scientific articles and reports. So with a lot of reading to enable you to do the weekly submission with the university, I gained a vast knowledge about almost everything in pediatrics, which capacitated me in the way that I'm able to diagnose, especially the rare things that we commonly see in Namibia. I have also set up a pediatric ICU, a 6-bed pediatric ICU within the Windhoek Central Hospital. We revamped the Pediatric Emergency Department at Karotara Hospital to be more suitable for children, because in the past the children were just seen in a corner of the adult emergency department. Now they have their own freestanding pediatric emergency department. I've also established an outreach program whereby we go out to the region to establish emergency services for children at the district hospital. So far, I've been to Otjiwarongo, Grootfontein, Swakopmund, and Gobabas. At Gobabas, we're also trying to establish a 4-bed high care unit for pediatric services. Children were previously a neglected part of the healthcare. You don't see a standalone children's hospital, you don't see a standalone children ICU or standalone emergency department. Those are all things we are trying to change, and by capacitating the doctors on the ground and doing trainings, in-house training with the doctors and also out in the region. So the knowledge that I have gained have made me more confident in doing the things that I'm required to do, to write up scientific submissions. I must say I'm literally bullying the whole department into doing this course and the other pediatric related courses that is funded by the Merck Foundation, because it really does add value to your life. It does add value to the way you manage patients. So if we all can get a chance to do this, it will bring excellence to the department and to the general child health population. So I would like to thank them from the bottom of my heart. It was an excellent opportunity for them from the Merck Foundation, having the scholarship, having gone through with the university, and having the type of mentors that they have assigned to us. Because you will get like a weekly phone call, and if you're a little bit late with your submission, somebody will call you and ask you, how are you? Have you been fine? Especially in the days of COVID, sometimes you'll just be late, not because you haven't done your part, just because you were busy with the patient loads, and also everybody was working at home from there. So you can imagine how slow the internet connection at home would be, because all of us are now in the house trying to get things done. So yeah, it will take a little bit longer than it was, but they were awesome. They will call you and they will talk to you and they will encourage you. For that, I'm very thankful. And for the foundation itself, it's brilliant work they are doing in Africa. I applaud them.